Go.
Knock, knock, knock. Good evening. My name is Carrie. I'm a student nurse from Southwest Tech. I'm here with an order to give you an antibiotic for your pneumonia that you're being treated for. Can you tell me your name and date of birth?
Kelly, 12/5 of 03.
And Kelly, do you have any allergies to anything?
Nope.
No? Okay. So I would pull the curtains for privacy. I would hand sanitize my hands so my hands are nice and clean. So Kelly, I'm here. We're actually going to be piggybacking off of this IV that you already have running. Kelly has dehydration, so we have some normal saline infusing her, and we're going to go ahead and do Rocephin as her antibiotic per the doctor here. So Rocephin, 1 gram IV every 24 hours for pneumonia. It's going to be given over 30 minutes. And it is a 1 gram per 50 ml bag. So I'll tell you a little bit about Rocephin. Ceftriaxone sodium is the generic name. Rocephin is the brand name. It treats serious infections. Kelly's using it for pneumonia. The dose is 1 to 2 grams every 24 hours, either in a single dose or in 2 divided doses. The single doses are generally done over 30 minutes once they are mixed and properly diluted and ready to be injected or infused. The class is the antibacterial cephalosporin. The action is, that it uses is it inhibits bacterial cell wall synthesis, which keeps the bacteria from continuing to divide and grow. The side effects, there is a full scope of hypersensitivity reactions, including anaphylaxis, which can be fatal. There's also burning, discomfort, and pain possible at the injection site, and it can also cause diarrhea, among several other things. There is no actual antidote for it. If the reaction is severe enough, we would have to discontinue. And due to the side effect of the diarrhea, you may need fluids and electrolytes to replenish from the diarrhea. Labs that we would be concerned with would obviously be your electrolytes, kidney liver function tests, but there's nothing really there's no labs that we have to do today prior to administering it. So we're going to go ahead and get everything set up here. I can look at Kelly's arm here, and I can see that she has an IV running here. The IV is in her arm. It is not infiltrated. Kelly, how does it feel today? Good. Okay. There's no redness. There's no swelling. It's not infiltrating or going into the surrounding tissues. That all tells me that it's in the vein like it's supposed to be. So no signs of phlebitis or infiltration. Nextly, I can see that everything's running. So nextly, we're going to go ahead and verify everything that we have here. These are for later on. First off, verifying with our order that we have here. The order is for, like we mentioned, Rocephin, 1 gram every 24 hours for pneumonia, given over 30 mLs, and it is 1 gram per 50 mLs. I have a 50 ml bag here of Rocephin. It is clear. There's no floaters. It is intact. So we're going to do a second check. It is Rocephin, 1 gram per 50 mLs. Rocephin here, 1 gram every 50 mLs. Still looks good, no floaters. It is within date. The expiration date is still good. So we're going to do a third check here of the Rocephin, 1 gram, 50 mLs over 30 minutes. Again, we have the Rocephin here. It is in date. It is all intact. Everything looks great. So we have our doctor's order here, which has been confirmed. The medication here has been verified 3 times now. So now we are sure that we have the right patient, which is Miss Kelly Freimiller. We have the right drug, which is our Rocephin that we verified on our order, and that we have here the right dose, which is going to be piggybacked off of our already running IV line. So the dose is IV. The right dose is the 1 gram per 50 ml. The route is it's going to be done through the piggyback of the IV, and we have the right time. I did verify in her chart that she has not had it in the last 12 hours. So we are okay to do it. We have our patient's 5 rights: the right patient, the right drug, the right route, the right dose, the right time. We have the right patient. It's good. So nextly, we're going to get rid of our orders here and our card regarding Rocephin. So we have this guy, he's all ready. Nextly, we're going to go ahead and look at our tubing here, our unopened intact tubing, which is also in date. The tubing is the secondary medication set. It's infused 10 drops per ml approximately. It is good and within date, not expired. Check it one more time. still good and within date. I did go ahead and get the medication calculations prepared in advance. So we have our 50 mLs that we know is going to be administered over 30 minutes. Our IV set here tells us it's going to be 10 drops per ml. So when we do our calculations, that comes out to 16.66 drops per minute. For our video, we're going to watch for 15 seconds, which is common. We wouldn't want to stand for a whole minute and count our drops. So we count 4 drops per 15 seconds. So we've confirmed all of these are good in that regards. So we're going to go ahead and open this package again. I'm going to take it out. We have our unused tubing here. We would close the clamp here. So we're going to just set this guy down here. He's untangled. These come with this extra clip here. The way piggybacks work is that the higher medication that's hooked up is what's going to run in first. So to start, we're going to lower our primary IV, which is our saline, our sodium chloride. So we hook it on here, and we're going to go ahead and hook that right there. So that's all set up there. Nextly, we're going to clean, actually we're going to go ahead and get this hooked up in this. So these would have been unused, so we want to go into the one with the blue hole, pull this guy off, and then we would go ahead and pull the cap off of this. And then without touching them, because those ends are considered sterile when they're brand new, thumbs point at thumbs, and we're going to go ahead and we would push them in like so. And it's already flowing because I've used this a lot of times now. This, it wouldn't do that, otherwise we would have to prime it. When it's brand new, you prime it, so. We're going to hang this up. So as you can see, this one is higher than our primary bag that is running, that continues to run down there. So next we're going to go ahead, alcohol. We would clean this for a full 30 seconds to get all the germs. Clean that off vigorously so all of the germs would be gone. And then we would go ahead and remove the cap off of this, and we would hook the 2 of these together. And as you could see, my thumbs were pointing at each other. We wouldn't touch the ends of those because this was the clean end, this was the sterile end if I had just removed that off of there. So that is good. Then we would go ahead and we would release this so our bag would, after we had primed it, so it would fill this up. We can't do that here because we don't have a real IV going, and I don't want this all over my couch and floor. So that's what we would do. So it's all hooked up here now. And then at this time, we would go ahead and do our drip rate. So we would have our watch with our second hand on, or our watch on the wall, and we would adjust this until we knew that we had 4 drops going per second, or per 15 seconds. So there we go. We have 4 drops going per second. And then our final thing for this one is we would have to label this. So we would take a piece of tape off. I would put the date, time, and initial this because we know that there's a label on here that says Brosephin, what we're doing, and then I would label this here so everyone knew when this was in. We also did confirm that the IV, it wasn't infiltrated, it wasn't, there was no phlebitis, and I did also confirm that that IV, it was just put in today, which I knew already from doing the initial IV, but I did verify that again. I just wanted to verbalize that. So that would conclude. We have this guy, he's gonna run from here until he's done, approximately 30 minutes, so I would keep checking in there. So Kelly, you notice anything different there in your arm? It's feeling okay still? Any burning or no? Okay. And it looks great. It's not infiltrating into the skin still now there, so that is all still good. So Kelly, that concludes me demonstrating the piggyback here for you. So don't shut the camera off yet because we have one more thing to do, but is there anything else I can do for you? I do have time.
Nope.
No? Okay, so at this point, don't shut it off. I would go ahead and document. But we have one more final thing to do, which would be to discuss how we would go ahead and remove this once all of this was done and we were ready to take the IV out. So for this, we would get our sterile pad out here. This would be like a saver. So we would put the saver down for any leakage, drainage, anything that come out. We would wash our hands. We would have clean, don't have to be sterile, but we would have clean gloves on to do this. So for this, if there was an IV in here and I was doing this on someone else, we would have some sterile 2x2s ready. So we would, first off, we'd have our sterile 2x2s on here. We would remove all the taping, everything that had it on their arm. Once all the tape was all off, with the sterile 2x2 on there, we would pull the IV out, pull it straight back directly out of the vein without holding pressure onto it. Pull it out, then we are going to hold pressure on it. We're going to hold pressure on that sterile 2x2 with our gloved hands for 1 to 3 minutes. Usually 2 to 3 minutes is more like it, but rubric says 1 to 3 minutes. So we would hold that there. After our 3 minutes or so was up, we would take that off. We would get another more sterile 2x2s and we would cover it up and we would tape that down. So that would conclude taking our IVs out of there. So Kelly, I just took your IV out. Is there, while I am here, is there anything else I can do for you?
Nope.
No? Okay, and at this point I would document that I did take Kelly's IV out, and then we would be finished. You can stop.